Hello and welcome. Today we're diving into a condition called Symblepharon. It's a medical term that might sound intimidating, but we're here to break it down and understand it fully. Symblepharon is essentially an adhesion, or sticking together, between the conjunctiva of the eyelid and the conjunctiva of the eyeball. This can range from a minor inconvenience to a serious threat to vision. So let's get started. So, what causes this adhesion to form? The most common culprits behind Symblepharon are injuries to the eye. This includes chemical burns, thermal burns like those from hot liquids or fire, and even physical trauma. Certain inflammatory conditions, like Stevens-Johnson syndrome and ocular cicatricial pemphigoid, can also trigger the development of Symblepharon. In rare cases, it can be a complication following certain eye surgeries, though precautions are taken to prevent this. Ultimately, anything that disrupts the normal conjunctival surface and leads to scarring can potentially cause Symblepharon. Let's delve into what happens on a microscopic level. When the conjunctiva is damaged, the body starts its natural healing process. This process often involves inflammation and the laying down of new tissue, including collagen. In normal healing, this new tissue is organized and doesn't cause problems. However, if the damaged areas of the palpebral conjunctiva, the lining of the eyelid, and the bulbar conjunctiva, the lining of the eyeball, come into contact during this healing phase, they can literally fuse together. This fusion forms a scar tissue bridge, resulting in Symblepharon. Over time, this adhesion can contract, potentially limiting eye movement and causing further complications. Regarding how common Symblepharon is, precise numbers are difficult to obtain because it's often a secondary condition resulting from other injuries or diseases. It's more prevalent in regions with a higher incidence of ocular trauma, especially chemical burns in industrial settings or from accidents. Inflammatory conditions that predispose individuals to Symblepharon, while relatively rare themselves, can increase the risk. So while not a common primary diagnosis, it's an important consideration in anyone presenting with conjunctival scarring or a history of eye injuries. How does Symblepharon present itself? The signs and symptoms can vary widely depending on the severity and extent of the adhesion. Mild cases may be asymptomatic or cause only minor irritation. More significant Symblepharon can lead to a feeling of something being stuck in the eye, restricted eye movement, difficulty closing the eyelid completely, chronic dryness, and even blurred vision. In severe cases, the fornix, which is the pocket-like space between the eyelid and the eyeball, can be completely obliterated, making it very difficult to wear contact lenses or even move the eye comfortably. Diagnosing Symblepharon is typically straightforward. A thorough eye examination by an ophthalmologist is usually sufficient. The doctor will carefully inspect the conjunctiva and assess the extent and location of the adhesion. They will also evaluate eye movement and check for any other associated complications, such as corneal damage. Medical history is critical as well, specifically looking for past injuries, burns, or inflammatory conditions that could have predisposed the individual to developing Symblepharon. In some cases, photographs may be taken to document the condition and track its progression over time. While Symblepharon have distinct classifications as such, it can be described based on its severity and location. We often categorize it as mild, moderate, or severe, depending on the degree of adhesion and its impact on eye movement and function. The location is also important. For example, a Symblepharon affecting the medial canthus at the inner corner of the eye may be more visually significant than one located peripherally. Understanding both the severity and location helps guide treatment decisions. The treatment for Symblepharon depends heavily on the severity of the condition and the symptoms it's causing. Mild cases might only require lubricating eye drops to alleviate dryness and irritation. More significant cases often require surgical intervention. Surgical options include sympleclysis, where the adhesion is cut, to more complex procedures involving conjunctival grafts or amniotic membrane transplantation. The goal of surgery is to release the adhesion, restore normal fornix depth, and improve eye movement and comfort. After surgery, meticulous post-operative care including topical medications and the use of conformers, small plastic devices that maintain the fornix, is essential to prevent recurrence. Prevention is always better than cure. When it comes to Symblepharon, the best way to prevent it is to protect your eyes from injury. This includes wearing appropriate eye protection in industrial settings, laboratories, and during any activities that could pose a risk of chemical or thermal burns. Prompt and thorough irrigation of the eye after any chemical exposure is also crucial. For individuals with inflammatory conditions like Stevens-Johnson syndrome, early and aggressive management of the underlying disease can help minimize the risk of conjunctival scarring and subsequent Symblepharon formation. The prognosis for Symblepharon varies. Mild cases may cause minimal long-term issues, while severe cases can lead to significant visual impairment and discomfort. Surgical intervention can often improve eye movement and comfort, but recurrence is a potential complication. Recent advances in surgical techniques, such as the use of amniotic membrane transplantation and specialized conformers, have improved outcomes and reduced recurrence rates. Researchers are also exploring new therapies to modulate the healing process and minimize scar formation following ocular injuries. It's an area of ongoing research with the aim of improving the lives of those affected by this challenging condition.